Intensive care is an emotionally charged environment, but this year has been unlike anything I've ever seen.
People are so unwell, and we thought we'd gotten over that. It's very difficult to see it again.
I am telling you, I've never been so scared in my whole life.
Dot was rushed to ICU last week.
The night before I got taken down here, I thought I was finished.
She's one of 11 patients being treated in Aberdeen's Covid intensive care unit.
We'll get you fixed.
In the next door bed is 83-year-old Meg.
You just do everything for us. This is a place in a million.
Being here is frightening, and Meg is just grateful to have made it this far.
Why didn't I give up very easily? Try not to.
Both Meg and Dot have been in intensive care for just about a week, but doctors say that this time round, most of the patients that end up here are staying for a lot longer.
One of the reasons for that is better treatments mean more patients have avoided intensive care, but those who are here can be even sicker. And with patients unable to have visitors, it's hard for staff as well as families.
They're phoning my daughter all the time to let her keep her updated on what's going on with me. They tell her everything, they don't hide anything, which is a good thing. So I'd rather they know the truth.
It has really been the most difficult year of to date of our nursing careers, but they have just gone above and beyond. All the nursing staff are working additional hours, they're working longer hours than they should do, they're having long hours in PPE.
First time in the first wave, we all had a sense of enthusiasm. We all saw an end in sight, essentially. We all thought we'd have normal plans by the end of the year, so we're a lot more motivated. But now, second time round, it's exhausting. Working in full PPE, working under these sort of restrictions, it's very difficult. And although we're still motivated to provide the high quality of care that we have, it's difficult, it's exhausting, to be completely honest.
Staff here say they've been lucky to escape the full impact of the second wave felt in other parts of Scotland. But a specialist national unit based here means they treat some of the most seriously ill COVID patients.
So we've got several patients in here who have coronavirus and who have been brought to Aberdeen.
The unit is not yet full, but admissions keep coming. It's also winter, and that brings additional pressures.
We're running two separate intensive care units. We have this unit here which looks after just patients who have coronavirus, and then we have another intensive care unit which is in another building on this site, but that needs our team to work across two areas, which really just adds, I suppose, additional stress. Our team have been working incredibly hard now for 6 months and longer, and there's really no end in sight at the moment, so we're all tired. We're all doing our best to manage the patients who are coming in.
Aberdeen Royal Infirmary has enough beds for over 600 patients. In winter, that capacity is always stretched. Cameron Matthew runs the hospital's acute services on a daily basis. It's his job to make sure there are enough beds for patients. He's on his way to the elderly care wards.
Red pathway areas here for COVID are at 81%, so there's still some COVID capacity for patients to come into. Then our haematology areas and oncology areas are 96% full, and our medical wards are 87% full.
There are well-worked plans to increase capacity, but the need for physical distancing means some beds have had to be removed from wards.
How challenging is that?
It's pretty challenging on a daily basis. It can be all you think about from the minute you come in to the minute you go out, and it can wake you in the middle of the night looking for enough beds for patients to make sure that they're safe. So, yep, very challenging.
It's only the start of winter and COVID is not going away. There is genuine anxiety about post-Christmas what January will bring. For now, the staff dig in and do their best.
See these people in here, they can't be more helpful. They work so hard. Honest to God, I've never seen them. They stand here for about 4 or 5 hours, not even a break. You know what I mean? They're there with you all the time.